Vibes Radio, the show is Seas and Sekal Rasta with I, Rash Riddick, aka Black Jesus.
And I, Nazizi, the original Roots daughter. And yes, we are on that time where we have an Empress Divine right here with us. Welcome, Dr. Vundi.
Thank you. Thank you for having me.
Yeah, man. Every time we like to have Empresses. So welcome to Empress Divine. I'm sure, is this your first interview?
Yeah, radio. But
you see, guys, we were telling you earlier, we want to bring the powerful women who, making moves in their fields and never get to talk about their story.
Yeah,
and I read an excerpt from your blog, right? You said, my good friend asked me to give my 2 cents on matters health, and I could not help draw comparisons between the state of healthcare in Kenya and the US. Yeah, I was reading. And you also have a channel titled The Wellness Doctor on YouTube, where you enlighten people on medical issues. So I want to welcome you again. Dr. Vundi, guys, is a medical doctor specializing in psychiatry, and karibu to the headquarters of Positive Vibrations.
Yes,
thank you so much. This is such a vibe. I like the positive vibrations. I'm really feeling it.
Yay!
Yes,
You guys, we didn't even have to ask her if she's feeling the vibe already. Bang, bang, she's on it. She's feeling the vibe. So can you tell us really quick, who is Caroline Vundi?
As you said, I'm a medical doctor. So I've trained here in Kenya at Nairobi University. I practiced for the government for a couple of years. I switched back to private. And then I went back to do my residency in psychiatry, but that's just what I do. But who I am is more than just a doctor. I'm also a creative, and that's why I'm out there doing a YouTube channel. I have so much that I have to give and offer, as opposed to just seeing patients and stuff. I'm also a friend, a sister. I'm just your regular average girl. Yeah.
That's amazing. So we have something in common. I studied psychology in university, actually I started in Malaysia and I finished in USIU. And it's something that really fascinates me is human behavior. I'm sure for you as well, right?
Yeah.
I find myself always checking out people and giving them names and disorders. Do you do that?
I do that all the time. Well, not giving people disorders, but even
naming the issues.
psychoanalyzing my friends, my close friends. People are starting to tell me, now this is too much. You need
This
to
is
stop.
too much. And when you tell people you're psychiatrist, do they say, can you read my mind?
All the time. It's so
I
annoying.
know, it's so annoying, because when I tell people I study psychology, they're like, that means you can read my mind.
That's
I'm
not
like,
how it
no,
works.
I'm not Ja, man. I'm not. I'm just here to, learn about human behavior. And it's very interesting. And so, guys, we have Dr. Vundi with us, to keep it here on Empress Divine, because we're going to be talking a lot about mental health and finding out a lot about where Kenya stands in mental health. Of course, Night Nurse is one of them. And yeah, man, it's playing right here on Season Second, and it's Empress Divine. And we have Dr. Vundi here with us, and we're speaking about mental health.
Yes, I. And I had the opportunity to see your channel earlier today.
Did you?
Yes, and it's amazing. And you were talking on your first show, you talked about a dark past where you had something about a dark past. Can you elaborate that for us and shed some light on it?
Yeah, that past episode was really intentional. I could have gone with any other thing, but I chose to just share with a personal experience.
Yeah.
Just so that people could relate to me. So what happened was I had a lot of childhood trauma. I think for me, that's as far as I'll share. But I hadn't dealt with it for a long time. And it manifested in a lot of toxic behavior, toxic relationships. So I was telling you guys earlier, I'm not who I was when I was in uni.
Yeah.
It was crazy. It was a crazy ride.
Yeah.
Okay.
And finally, everything blew up when my dad passed away. And that's when a good friend of mine just had to reel me in and take me to the therapist. Yeah.
And is that why you decided to get into psychiatry?
Partly yes. But another reason is because mental illness runs in my family. So my grandmother has got severe depression and anxiety, and I've got several friends who also are battling with the same. So it's very close to home. And then also just from my practice, I saw a huge gap. There are not a lot of doctors going into psychiatry.
Yeah.
So there's literally about 100 psychiatrists in the whole country. So for me, everything added up, and I found my purpose and my calling.
No, that's amazing.
Yeah, man. And I like what you said about childhood trauma, because not so many people take this thing seriously, because especially I think in Africa, right? Or you were a kid, you must have forgotten what happened to you.
I blocked it, yeah.
Including the people who actually traumatized you.
Yeah.
They will come in your face years later and act like nothing ever happened.
Yeah.
And that's really bad, And it's important for you to tell people, like, if you don't work through your childhood traumas, it can blow up on you.
Thank you so much, Naz, for saying that, because sometimes even other people know that this person, hurt you or was a bully or whatever, and nobody stands up. So I think the challenge is we need to also stand up for kids.
Yeah.
If you see a kid who's being harassed or bullied, don't wait for that child to have issues in future. Just stop it right there and then. Call the person out.
Yeah, and for me, I think, my parents were divorced when I was very young, and it was even a taboo to talk about divorce when, in school, guys would be like, wow, what? Your parents are divorced. And for me, it was like an ordinary whatever, but I realized now, like when you said you realized later when your father passed away, there was some things about that really affected my life for a very long time, especially as a kid. Sometimes you blame yourself for these things, and nobody is guiding you and saying, it's not your fault. It's got nothing to do with you. And right now, I'm divorced as well. And so I think about things that I have to tell my son, things that will help him heal from it, because you can't just, think that he will just deal with it in him toto, so he will get over it, and when he grows up, he'll forget about how it was.
And that's the best thing you can do for him, and that taboo thing is crazy. Like, there are situations we'll have in the hospital. Let's say I see a patient and it's a minor and they're abused, and most of the time the parents will say, just hush it out, no need, we won't go the legal way. And sometimes it's so frustrating as a doctor, because you can't force issues. You can't say, I'll take you guys to court. So that hush thing is so common.
Yeah, and that reminds me of the famous movie that came out about it was the 5 African American kids, and there was one of them whose dad couldn't stand up for him because he felt intimidated, right?
Yeah. And they see us. Yeah.
When they see us, right? Yeah. And for me, that really hits home, because I should be the protector of my child, and my child is looking at me as the protection. So if something happens to him and I'm coming there like, shh, don't talk about it. It's like, who has my back? Yeah. Who is even there for me? And that can just damage you for years, can't it?
Yeah. And it can even damage the relationship, because even in the movie at the end, the guy and the dad have never done. Yeah. So you're just setting yourself up for failure. That relationship will obviously fail when this child is an adult and it hits them. Okay, this guy didn't stand up for me.
Yeah, we need to stand up for people, and not just children, women, even men get abused, and we need to stand up for them. If you notice your friends or family are going through something, don't tell them to hush about it because it's going to embarrass you. Stand by them. And man, we'll be back on Empress Divine.
And yes, we have Dr. Vundi in the house.
What's up, guys?
Yeah, man, and it's amazing. It's really amazing, because I want to ask you a question on depression. So online, it stated that it is estimated that 4.4 of Kenyan population, that's 1.95 million, that's 1.95 million, suffer from depression. That starts from 2015.
Yeah.
So now in depression, why is it with the economic situation right now at the moment, a lot of Kenyans are in depression. And how do you deal with such cases?
So that figure, as you can already tell, there's a problem, because that data is from 2015.
2015, yeah.
So we have a challenge of we have a challenge of getting research and funding for research. So that's the number one problem. So we don't even know the number. It could be bigger. But there's so much that's contributing to depression, and as you mentioned, financial problems. So especially the low socioeconomic guys who are coming from that setup, they can't even afford some of the medication, they can't afford therapy. So how do we deal with it? Most of the time, social workers are amazing. In some instances, they'll go from like home to home and speak to people in the rural setups, but also church-based organizations and the NGOs. But it's a bit unfair that we've left it to church-based organizations, charity. I feel like we need to take ownership. We need to
take charge in
take charge.
Yeah, and I see like from the mental health conference that happened recently in Kenya, they say that close to 4.7 million Kenyans. So if we want to put that in easy terms, 1 in every 4 Kenyans is suffering from depression. And that's from IG and just from the recent thing, you see. So to even get the research, as you said, is very difficult. But I want to know, some of the things that people don't discuss is symptoms of depression, because depression is something that is very tricky to diagnose, right? It could be a mood of a day. So you're like wondering, is this person just down for today, or is it a cycle of always being down? So I want to know, like, from you, what are the typical, things that you can look out for to know, okay, my friend or my partner or my family member is going through depression?
Yeah. So with depression, depressed mood, a low mood for about 2 weeks consistently, that's usually the first diagnostic criteria. So we're not talking about having a depressed or a sad mood for like a day or two, every single day for 2 weeks.
It's not feeling hauna kakitu kwa mfuko sasa uko depressed.
Okay, so you see this person just going downhill, like they used to talk at least, they used to socialize a little bit, but for 2 weeks straight, you're just in your house. You don't want to leave.
Yeah, and there's like more to it. So that's the number one thing we look out for. But there's more to it. There's something we call Anhedonia. So that's where you don't find pleasure in nothing. So in the things that used to give you pleasure before. So let's say you used to like football, but nowadays, doesn't give you any pleasure. Nothing makes you happy. Music doesn't make you happy. You don't want to hang out with your friends. So Anhedonia. And then other simple things like sleep changes. So you're not sleeping at night. Or you're sleeping too much. Like, have you ever met someone who sleeps all day?
Yeah, that's someone who's totally depressed, I can tell. Well, I think so. For me, I did go through depression as when my brother passed away. He was like, when you're two of you in the house, it's always together, and then went into just nobody else. And just what you described, I never wanted to leave the house. I never want to even wake up. I was like, I'm not doing music anymore. I don't want to do it. I wasn't interested in hanging out with my friends, but even I, who studied psychology, couldn't tell I was depressed. And that's one thing we need to know. It's not something you can just point out really easily. And we're having a lot of challenges in Kenya when it comes to mental health sector, right? Lack of enough psychiatrists, lack of medication, proper medication, because I was telling Riddick earlier, in Kenya, it's so typical to just give everybody the same medication because it's not available.
Of the diagnosis.
Regardless of the diagnosis. And mental health is not a permanent situation. A lot of people have had anxiety or depression or episodes and have overcome it and, moved on to a better life, right? So now that we know what the symptoms are, what can we do to take care of our mental health?
There's a lot you can do to take care of your mental health. First of all, being aware. So as you said, sometimes you're not really aware of like how I am right now, but sometimes when you're going through certain episodes, let's say grief, divorce, separation, or even something like a heartbreak. Those are the times you need to be in tune with either somebody to talk to or just be aware and gauge yourself. Another thing I was talking about earlier, I was at another event, is to regulate your social media, because there's one study which showed that high social media use is causing depression and anxiety. So you're looking at people online, they're looking so fabulous, you're comparing yourself. So you can just limit those kind of envious behavior or even harassing people online. These trolls who are like,
trolls, you can tell that they have serious mental issues. Let me tell you, being an artist, honestly, I personally, I will see a comment on my page, I'll be so pissed off. I want to reply, but I'm like, wait, this is like a mentally unstable human being. Why are you even replying them, right?
It's more of a reflection on
them, how they feel about themselves,
and not you as a person.
So trolls, we see you and you need some help. You should stop hating. Stop it right now. It's all about positive vibrations. And man, we're speaking about mental health with Dr. Vundi, and we'll be back. Man. And you know what I want to ask you, Dr. Vundi? So a lot of cases of mental disorders are also drugs related, right? Can you tell me something about that? And I have a very interesting question, actually. From the Vibes Nation, Ochija Messenger said, my question is it true that the good number of mental patients in Mathare are cannabis users?
Okay, so there's some truth to it. There's a good number of them. But the thing I like to, I'm not on any side.
Okay.
But this is the thing. If you've got a mental illness and then you use cannabis, you'll definitely, so let's say you had a mental illness and it hadn't manifested, and then you use cannabis, you use it, yes, it can induce psychosis.
Yeah, because this is what I've been telling people also about cannabis. It reacts differently to different people. And so depending on who you saw smoking and how they reacted, you might think everybody's like this cheesy that I just saw running around crazy, right? But it's different. And Dr. Vundi, I like that point, because if you have a mental disorder and then you smoke and it brings it up, and then people start blaming the actual drug and saying, oh, ni wase wa bangi ndio na chizigi, right?
Thank you. And the thing with drugs is that even some people who they're okay with their drinking. They drink, they're in control of their liquor, yet there's somebody who cannot cope.
Yes.
Exactly.
So my message is always, it's different. Don't try and be someone else's story or figure out your story. And something else is also to know your limits.
Yeah.
And there's a lot of gateway drugs going on. So some people will be buying marijuana, but then it's got some other
stuff
in it.
Yeah.
And that's how our youth, that's how they're getting into stuff like heroin, and stuff like that. So it's different strokes, different folks.
Yeah, man. And so apart from depression, because we saw that 1 in 4 Kenyans has depression, right? What is another mental disorder or problem that you can see in the society, being very rampant? We were speaking earlier about different people in different fields needing counseling as well.
Yeah.
Police officers, even doctors, even nurses, even psychiatrists themselves have to debrief, right?
Thank you.
So guys, even the psychiatrist has to see another counselor and talk to them about maybe cases that affected them, for them to be able to cope with all the hard stuff that they go through every day, right? But in our system, it's something that, as you said, it's such a hush-hush thing, We need to make more noise about it. And I loved one thing you said when we were off air. You said before, guys used to speak about HIV don't talk about it. You can't even tell somebody. Yeah. And right now, that's where we are at with mental health. We're let's not talk about it. It's embarrassing and whatever. But I wanted, if you can answer my question.
Yeah. So the second commonest thing I see is anxiety.
Okay.
So people are becoming anxious all the time, and I blame the workplace environment. They want you to be go all the time. There's high targets, and especially for doctors, I've seen it a lot. People getting panic attacks. You step into the office and your heart is beating, you're sweating. And the thing with, depression is very manifest. Anxiety is not so manifest.
Yes.
So you could be having anxiety and you don't even know you have anxiety. So that's the one thing I would say is the second commonest for me.
And that's funny because I always say I have social anxiety, which is funny being a celebrity.
Yeah.
Because you have to be in groups of big people, a lot of people, and you can't be anxious about it. You need to be on point. And I didn't notice this until much later in my life. Yeah. When I would all of a sudden be surrounded by 20 people trying to take a picture, and I'll just freeze and I'll just feel like, oh God, can someone take me out of... Riddick will tell you I go through it when I see a group of people coming, and I'm like, oh Riddick, are they coming here? Are they coming to us? Oh my God, they're here,
That happens a lot. Social anxiety is so common. And it's, again, I'm boiling down to social media. People are being forced to act perfect, to look perfect.
Yeah.
So when you step into the real world, you feel kind of like, oh my gosh, who am I? How do I look? And all that.
I look like my Instagram page? Yo, that pressure is real. And for me, I try not to succumb to that pressure because this is how I look on a normal day. This is how I look on my page, except for a filter. But which is fine. Yeah. But it's really good to know that apart from depression, guys, anxiety is one of the things that Kenyans are going through. And when we come back, we want to find out if you are going through a mental disorder, where can you go for help? So stay tuned.
Yes, my people. Vibes Radio. I listen to this is C's and Sekal with Irish Riddick, aka Black Jesus.
And Inazizi, the original Roots daughter. And we've had the pleasure of speaking to Dr. Vundi today. And my time goes on Empress Divine because now we just have a few minutes left with you.
Oh, yeah.
I know, right? And we just have so many questions still. I guess this is a topic that we can never really complete.
Yeah.
But one thing I wanted to, we were saying, you have to get help. It's something in our society as Africans, we don't like to get help for mental health illnesses or even trauma or even, a lot of things. We just like to hush it. So where can people go for help, especially if they can't afford 2,000 or 2,500 a session?
Okay, so if you can't afford 2,000 or, where the consultation is a bit high, so Mathare Hospital does have some therapy, but of course the resources are strained because of the numbers. But if you feel like you genuinely cannot afford, I think they usually charge about 100 bob to just open a file. and from there, you can get the services you need, and NHIF also can cover in that facility.
Okay.
But other than that, if you're a regular Kenyan, I feel like there are so many online platforms that have come up where you can get therapy online, and that brings down the cost because you're not paying for a therapist who's paying for rent. Yeah, so this person is counseling you on your phone. So we've got one of them is called Bonga. You can check them out online. You can call them at any time, get somebody to talk to you. Another one is called Wazi. So you can just contact them, and then they'll hook you up with a therapist, and they can counsel you from that side. And it'll be definitely cheaper because you're not going to the office. And sometimes, as I said, with depression, you don't feel like waking up and going.
Yeah, man.
So imagine just having somebody on your phone who you can talk to. And this is not sponsored. I don't have any affiliation with them. I just think it's a fantastic initiative.
Yeah, that's amazing. That's amazing. And also,
these are Kenyan. Sorry, these are Kenyan.
100%. Yeah.
Okay, what did you say the names are again?
The first one is Bonga. The second one is Wazi.
Okay.
Yeah.
Yes, and I had a quick question about mental disorder and CAT. Our youth nowadays have engaged a lot into Mogoka, Veve. Does it reflect any issues on when it comes to mental disorders?
Yes, there have been some people who've come in with psychosis, so psychotic behavior. And then when you look back, there will be no family history. There'll be nothing else other than the fact that they're using CAT. But as I said, there's no research, so I cannot say
for
definitively yes. So that's what I was saying. We need to do research. So when we're talking, we're speaking in confidence that yes, this thing causes this. But yes, there have been patients who use CAT and they get psychotic.
Man, that's sad. But so guys, first of all, know your mental status before you start engaging in drugs.
Yeah.
You can tell what kind of person you are before you start getting mixed up in all these things, and then next thing you know, you're at Mathare, and we know the situation there is not easy because there's a lot of mental health issues and not enough doctors as well. And we want to know, where can we follow you on social media, by the way?
So on YouTube, you can follow me as I am the Wellness Doctor. On Instagram and on Twitter, I'm Dr._Vundi. That's Vundi. And on Facebook, for those guys who are still on Facebook, I am Caroline Mundy.
Amazing. Yes, yeah, and I have a quick question here from Vibes Nation, right? And they're asking, does rehabilitation really work?
Yes, it does. Yes, it does. But the person has got to be willing. So most of the time when rehab doesn't work, it's the family that's forced issues. You've taken somebody there forcefully. So if he doesn't want to go, you're better off just doing something else. Yeah. But also sometimes they might require more than 1 or 2 or 3 rehab sessions.
Yeah. And what's your final word for people out there about mental health? What do you think is the thing everybody needs to know?
I think the one thing I would say is it's okay to not be okay. Yeah, it's okay to be, to have a mental issue. Just speak up about it, get help. Don't stay in your little cocoon, not sharing and not telling anybody.
Wow, it's been amazing, and I'm in my zone. I don't want this to end. I feel like I'm going to be talking about this for another hour, guys. Empress Divine is coming to an end. We've had Dr. Vundi, and we've been speaking about mental health, and I'm going to tell you one thing. We are definitely going to have Dr. Vundi back again. Yeah. Did you feel the vibe? You told us.
I felt it from the beginning.
I know. So we usually ask this question at the end of the interview.
Really?
And so it was very funny that before we even asked you, you said, I feel the vibes and I love the vibes. I was like, you see, the energy is just correct.